This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by the woman in you.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Tonight we have a local chiropractor with us. Her name is Dr. Jennifer Eames, and she is a chiropractor here in Marion at the Marion Family Chiropractic Center. Welcome, Dr. Eames, to our show.
Thank you for having me.
The reason why we invited Dr. Eames tonight is because when most of us think about chiropractic care, we think about, I hurt my back on the job, or maybe skiing down a mountain and I go to the chiropractor to get care. And a lot of us don't realize just how important chiropractic care can be to optimizing our health. And Dr. Eames is well known in our area for her educational expertise in helping her patient base learn about the benefits of chiropractic care. So that's why we've invited you here today.
Great.
So I wanted to start by asking you how chiropractic care optimizes health. I mean, why the spinal adjustment and alignment is so important for our overall health.
Yeah, and you're right that that's not something that a lot of people think of. They think of the injuries or back or neck pain, and then we're fully able to take care of that. But the most powerful thing that we do as a chiropractor is really get someone's body working the way it should so that they can be healthy and stay healthy from within without needing things from the outside. And the way that works is our brain is running everything in our body. It's detecting if we've come in contact with a virus, it's running our organs, it's running our muscles, everything. And the way that it does that is by sending messages down the spinal cord and then out through all the nerves that then branch and go throughout your body. The nerves come from the spine and come out from between each of the vertebrae. So if you have a vertebrae that's out of alignment or it's stuck, then those signals aren't going to be able to go through as efficiently and are going to affect wherever that nerve is going. So if that's a nerve, for example, that is helping to run your lungs, it's going to make breathing a little bit more difficult. And, we see people in our office that have trouble with asthma, or someone who might want to come in before they know they're going to run a marathon. And they know that when they get adjusted, their body's working better and they're going to be able to breathe that much better. And we
So
see
if someone has something like asthma, they might not necessarily have any pain in their spine.
Correct. About 10% of nerve fibers in our body transmit messages of pain. And that's why sometimes when things are out of alignment in your spine, you will have pain. You'll have back pain or neck pain or headaches. But 90% of the nerve fibers are running everything else in your body, the stuff that keeps you healthy and keeps your body running smoothly. So getting things in good alignment for your spine, it is, like I was saying, even more powerful in terms of your health as a whole to have your body working the way that it should.
So, so you're saying that having the spine in alignment is important for the nervous system to be able to communicate and do all its metabolic processes that it can do. Can you talk a little bit about the immune system and how having chiropractic care can benefit the immune system overall?
Yeah, absolutely, and that's one of the most exciting things that we do. It's really fun when we have whole families that will come in to our practice, and we're able to take care of them through a winter, and those end up being the children that don't miss as much school because their immune system is working better. The way that works is, again, our brain is detecting when we come in contact with viruses, with bacteria, whatever else. You have situations, and we've all been there, where you're on an airplane or you're sitting in a movie theater or your child's in a classroom and the person next to you or your child is coughing. Someone who's sitting on one side of that person may end up getting sick and the other person doesn't. The person who doesn't get sick, their immune system is working better. And what they found with chiropractic is just the research doing simple blood tests before and after someone's adjusted. After they're adjusted, they've been shown to have higher immunoglobulins and higher white blood cell counts. And those white blood cells and those immunoglobulins, those are what prime our body to be able to fight off the stuff that we're all exposed to every day. So those are the people that aren't going to get sick when they're exposed to things. There's really two sides of getting sick. We always worry about the exposure to different germs or viruses or things like that. And that is something that we want to try to minimize. But we're also not going to get sick if our body is working the way that it should, and that's where chiropractic comes in. Get your body working as efficiently as possible, so when we are exposed to things, which we will be, we're not the people that are going to get sick.
So overall, having better circulation of your nervous system
Correct.
will help that, and chiropractic does, and you were talking earlier about exercise helping?
Yeah, and there's a lot of other great things that you can do for your body to help boost your immune system. There's things you can do nutritionally. Exercise is excellent. It's a great way to combat things. Exercise does two things. One, it increases your circulating white blood cells. So again, when we're exposed to something, if we're a regular person who exercises, our body's more ready to fight that off without us ever being sick and ever realizing that our body's even done it. It's brilliant what our body's able to do. Exercise also brings up our body temperature a little bit when we do it. And when our body temperature comes up, that is also going to fight off those bacteria and those viruses because they have evolved to live in our body temperature. So if once a day we're bringing it up a little bit, it's going to kill those off really efficiently.
So your practice, in your practice, you have patients that range from newborn infants to the geriatric crowd, people who are actually 90 years old and older. Yeah. Can you talk a little bit about the elderly people? How can chiropractic help an elderly person? You know, someone who might be getting a little stiff or have inflammation or, sensitivity. Well, you talked about the immune system a little bit, but and then also on that subject, what's the difference in how you do care for someone who's a 25-year-old athlete compared to how you work with someone who is an older woman, say?
Sure. Just to start with the benefits for the older population, which are they're a wonderful population to work with because there are so many things that happen in our body as we age that we think, well, it's just because I'm getting older. It's just because I'm getting older that I can't do these things. Well, that isn't necessarily true. If someone has a misalignment in their spine and we correct that, regardless of their age, they're going to have that increased range of motion, that less stiffness, more comfort in the things that they do. We have people that come into our office who are playing tennis well into their 80s, and so there's that piece of it. There's other pieces of it too to do with the efficiency of how our body works. One thing that a lot of older folks worry about are the falls that tend to happen. And balance is one of those things that's also regulated by our nervous system. So if we have things that are out of alignment in our spine, our signals from our feet to keep us well balanced and keep us upright aren't going to get there as efficiently to our brain, so that if you are carrying that big basket of laundry down the stairs and all of a sudden you think there's one more stair than there is, we've all done that, if that signal comes as efficiently as possible, we're going to stay upright and we're not going to have that fall. Same is true with older folks. So really working on balance with them is one of the really good things. And older people also are one of the populations that we worry about those infections that they might get that can lead to more complications in that population. So having the adjustments that help to boost that immune system for them is another really powerful thing that contributes to their health and longevity and quality of life.
Now, a lot of the older people, too, will tend to have more of a curvature in the spine develop, maybe from a little bit of osteoporosis and so forth.
Yeah, and there's those physical changes that happen as people age also, and we're able to really minimize that for someone, keep things moving properly so they don't start to get that extra hump on the back, that extra curve that then gets stuck there. And we do a lot of adapting when we adjust different people. A lot of people, when they think about chiropractic, like you were giving the example of a 25-year-old athlete, we certainly see those folks. And people associate chiropractic often with the heavy-handed, very physical adjusting. If we have someone who's coming in who's in their 80s or 90s, or if we're seeing small children and infants, there's a lot of adapting that we do to use very, very gentle techniques. So we are able to see someone who has osteoporosis or maybe already had spinal surgery and it didn't work for them. And we can work around that and we can adapt. And you don't always get that popping or cracking noise. It's actually a minority of chiropractic techniques that are in that way, but that's just what commonly is out there and thought of as being chiropractic, but it's actually a very small part of it. We're able to do some really gentle things to help folks, to guide things into alignment for them and get their bodies working better.
So let's talk a little bit about chiropractic care for injuries, since a lot of people have back injuries or athletic injuries and so forth. How do you help a person overall? Is it a long-term thing, or is it?
In general, if we have someone who first comes in the office, whether it's an injury or anything else, often we have to see them more often when they first come in to be able to get things in alignment and get them stable for them. We are able to work with all kinds of injuries, and the research on chiropractic is excellent. They found during workers' compensation research that those people are back at work and more comfortable much faster and much more efficiently. Same thing with athletic injuries. People who have herniated discs, that's one of those things that people have a lot of fear of, and they're just awful when that happens. But chiropractic care has been shown to be more effective than physical therapy when you start working with these folks. So we're able to get someone through an injury, get their spine in good alignment, and from there often what we recommend is they do come in occasionally because we want to check their spine and make sure things are in alignment. Like I was saying earlier, only about 10% of those nerve fibers deal with pain, so you may have something that's beginning to go out of alignment or is out of alignment and is affecting their health in another way. So with people that come in, we do recommend that they come in occasionally so that we can check their spine to prevent injuries going forward and just to keep their body working efficiently and to keep them healthy.
And so is inflammation a part of that? Are you able to help reduce inflammation?
Yeah, absolutely. Because your body will create an inflammation around an injury because it is trying to protect that area. And once that mechanism in the first few days is done, sometimes that inflammation can really stay in there, because if things are out of alignment, your body can't regulate itself as well to now bring down that inflammation on its own. So a lot of people want to take things from the outside and they think, well, if every day I just take ibuprofen, then this isn't going to hurt and it's not going to be inflamed. Well, that's not really getting to the root of the problem, besides the side effects of doing something like that. What we're able to do is get in there, get things in good alignment, and then your body can get rid of that inflammation on its own, and it's not going to come back and not be something that constantly has to be attended to.
A couple of things I wanted to ask you about is TMJ and also migraine headaches. A lot of people suffer from migraines and really just have no solution for it.
Yeah, and we have people who have come in and they said, I've had these headaches for 10 years and I've been to all the specialists and I've had MRIs and CAT scans and x-rays, and I keep being told that, there's nothing there that is normal. And it's not normal to have headaches for 10 years, and they can really affect someone's quality of life. And as chiropractors, what we're looking for is a little bit different. It's called a vertebral subluxation, and we are trained to screen out for all the big stuff. Is there a tumor? Is there an aneurysm? Is there a fracture? Some decay or something else that is happening that's creating this headache? But we're also looking for that one other piece, that vertebral subluxation, that vertebrae that's gotten out of alignment or gotten stuck, that's then affecting the nerves, because the nerves also run, especially from the upper part of your neck into your head. And if that's out of alignment, that's going to affect the muscle tension there, how the blood vessels are working, and everything else. And that often is what is creating a migraine. So we're able to adjust someone to get it in alignment, get the pressure off those nerves, and then they do great. And we are the only people that look for that piece of it. And that's why people have been able to, even after 10 years of going just about everywhere, coming to a chiropractor and finding a solution. So it's not that everybody else is wrong with what they're saying. It's that there's this extra piece that we're the only people that look for it.
Oh, and so do you find that stress is related to that?
Absolutely. Absolutely. The stress that someone is under, whether it's emotional stress, physical stress, it's going to play a physical role in their body, and it's going to impact that nervous system also. So that's something that we work with people also to help reduce some of those other things that can be affecting their body. A lot of times adjusting someone, because now their body's able to integrate everything better, their nervous system can integrate everything better, that alone will help to reduce their stress levels just because they're feeling better. So
Right.
There actually was a great study they did in New Zealand where they had people who were under chiropractic care, and they took care of them, like I was saying we often do in the beginning when someone comes in fairly frequently. And then when the person was finished with that phase of care, one group they told them they didn't need to come in anymore, and the other group they told them to come in just every once in a while and have things checked out, make sure that things are okay, and adjusted them if it was necessary. And what they found 9 months later, they gave those people a standardized psychological survey of overall well-being. Not did your injury come back, but how is your outlook on life? How is your stress? How is your well-being? And the people who came in on occasion scored significantly higher than those that didn't. So it's kind of a neat aspect to be able to affect someone's life like that and reduce that stress and have their outlook just be better.
Yeah, it calms people down when everything's working well.
Yes, absolutely.
So what about TMJ and the pain and the limited movement, and how does that affect not only the restriction in the jaw, but the circulation in the head and the spine?
Sure. Often if someone has the trouble with their TMJ, we like to look at a couple things. One is the alignment of the jaw. Chiropractors also work with joints like the jaw or the various extremities, knees and hips and ankles and elbows and wrists and so on. Check that alignment. Also, the very top vertebrae in your spine comes right behind where that TMJ joint is, that jaw joint. So often that will be out of alignment also, which is contributing to the problem. So by adjusting that, getting some of the muscles to relax around the jaw, we're able to help those folks out, because often they will have the jaw trouble, but they'll also have headaches and other things that go with it. And we're able to take care of that by getting things in alignment and letting their body work the way that it needs to free that up.
It's interesting how you talk about, working the spine to help with, something that doesn't, say like asthma. Who
Sure.
would think to get a chiropractic care to help with asthma? But
Yeah.
really, with, the vertebrae, the nerves feeding in from the vertebrae,
Absolutely.
it makes sense. What about things in the extremities? So if people tend to have carpal tunnel or they have just, a stress and strain maybe in the elbow, how would chiropractic care help with that?
Well, in two ways, and actually I'll use carpal tunnel as an example because we do have a number of people that come in with that. The carpal tunnel is actually an anatomical part of your wrist, where your wrist bones should be aligned in a C, and that's why your wrist is softer on the bottom than it is on the top. If that's out of alignment, if any of those tiny wrist bones have come down into where it should be a nice tunnel with the inside of the C, then that's going to affect those nerves. So often we can adjust the wrist, get things into better alignment in the wrist itself, and that's going to free those nerves up in the wrist, and it's going to take care of someone's carpal tunnel. Carpal tunnel also is often misdiagnosed because when there's a problem with the hand, it becomes an assumption that the problem is probably with the wrist, with that carpal tunnel. You can also have, because the nerves run all the way up from the neck, problems with someone's neck that are then affecting the hand. So anytime someone comes in with carpal tunnel, I like to take a good look at what's going on with their neck too, because often the nerves will be actually impinged up at that level and then affecting things all the way down. And we've had a few people who have come into the office that were ready to have neurosurgical consultations on their wrist that it turned out actually to be a problem with their neck. So we were glad that we could take care of that for them and keep them out of having a surgery that in all likelihood wouldn't have worked because that wasn't where the problem was.
So we shouldn't really wait until we're in pain or have an injury to come to a chiropractor. And it sounds to me like chiropractic care is a great way to prevent getting sick and to also keep our immune systems healthy. Do you have many patients who are your wellness patients who really just come in regularly because they know it's like getting their teeth cleaned, it's something that they need to do?
Yeah, it is, and that analogy to getting your teeth cleaned or dentistry is perfect. It's also important to take care of your spine in the same way that you take care of your teeth, where keeping that in good alignment, it is going to help boost your immune system, keep your body working better. So it's going to prevent a lot of these problems going forward, whether that's a physical injury or that's an illness or a sickness that can be developing because that nerve flow constantly can't go through properly, say, to someone's stomach, and eventually that can lead to an acid reflux because the signals are just off.
Right.
So we do have a number of people that come in just for that wellness aspect of chiropractic to keep their bodies healthy, and they see a very real difference in them and in their families, being healthier through a winter.
Is it far-reaching to say that people who have digestive issues or allergies can benefit from chiropractic?
We do see, and the research is really good with both digestive problems and allergies. The digestive system, the stomach and the intestines, are also run by the nervous system. So if there's some sort of blockage in there, it's going to give people more trouble trying to work with that. So with allergies are similar to what I talked about with the immune system, but an allergy, instead of an underreaction to a virus or a bacteria, an allergy is an overreaction to something that's in the environment. So the adjusting helps to stabilize that immune system so people are less likely to have those overreactions.
And what about any female issues, especially around menopause or even for young girls who might be struggling with their menstrual cycle or pain from that? Do you find that increasing the circulation to different areas, the hip area, or?
Yeah, and it does help. So it helps to stabilize the hormones somewhat through menopause, but for younger girls or women that have a lot of trouble around that time, the cramping or the back pain, the things that go along with that. We have some people that specifically schedule their appointments before they know that it's that time, because then it's much easier to go through it because they don't get a lot of that, the cramping or the back pain or the other things that they used to have. So we see people do a lot better, and even in terms of the regularity for people that get the irregular periods. So,
right.
Yeah.
So as far as hormone balance, it just, getting the circulation to help the immune system is in turn going to help the hormone balancing.
Yeah, definitely. And the nervous system is running our endocrine system and the hormones. So having that free to give out the hormones and the balances that are necessary for things to run smoothly is really important.
I want to talk a little bit about infants and pediatrics. Now, we're going to do another show, and it's going to be really based on child care. But just so that for the people who might not be able to catch that show, just to touch on how important chiropractic care can be for young infants, toddlers, or even our young athletes,
Yes.
you know, in elementary school, junior high, and high school. Can you give examples of, say, I think you were talking about scoliosis a little bit earlier, or just a couple, maybe one or two signs of a need for chiropractic care?
Yeah, I'll start with scoliosis, and then I'll get back to infants a little bit. Scoliosis is a curvature of the spine that shouldn't be there. And often a parent will be able to notice that. The kids do get checked in school for it, but a parent will be able to notice it if they realize it seems that their child is holding one shoulder higher than the other, and that's what their posture looks like. It's also not good if a child's posture, if they tend to hold their head farther forward. That's going to put a lot more stress on the spine. And we've had people that have come in as elementary school age children that even were told that they had a 100% chance of needing surgery to insert rods in their spine to correct the scoliosis that was continually getting worse and worse and worse. And one boy, we began taking care of him, and his scoliosis stopped progressing and improved a bit. And his doctors in Boston on his next follow-up said, you know, whatever you're doing, just keep doing it. You know, and that boy now is a senior in high school, and he's active and out skateboarding and doing all the other things with kids, and he's never needed that surgery, and they're saying now that he probably never will. You know, so it's really exciting to work with those children and know that this is something that is really going to impact them for the rest of their life.
Yeah,
you know,
so it seems like that should be first line of strategy.
Absolutely.
You know, surgery being the last resort.
Yes, absolutely. Yeah. And I think often parents are told, your child has a scoliosis, let's wait and see. And it may or may not get worse when you're waiting to see. And so that's where it's good to go to a chiropractor, because we may really be able to correct this for the child. So with infants, it's a great time to get an infant spine checked right after they're born, because that birth process it's not easy on the mom, but it's not easy on the infant either.
Yeah.
You know, we hold them so carefully once they're born, but the process of getting them out, the shoulders out, the head out, there can be a lot of stress on their spine. So we like to check children's spines soon after they're born, just to be sure that things are in good alignment for them. And adjusting an infant to make sure that their spine is in alignment, it's very, very gentle. It's just lining things up just right and pressing on them about as much as you would to test a tomato to see if it's ripe. It's very, very gentle, guiding things into alignment for them. But things that a parent may see on an infant that they may notice is sometimes infants will hold their head crooked, or they may only want to breastfeed from one side but not the other. And that often means that there is stress, especially in their neck, and they're not able to do these things comfortably, like hold their head straight or be able to breastfeed from both sides. So that may be some things that parents would notice that would mean it's time to have their spine checked.
Sounds too like the mom and the new mom could also use the chiropractic care.
Absolutely. And actually there's an interesting study that they did on pregnant women and chiropractic, that besides that the women feel better going through their pregnancy because the shape of their spine is changing through that pregnancy, a lot of women get back pain or get sciatica because of the shape of their spine.
Or varicose veins.
Or varicose veins. We're able to keep them more comfortable during their pregnancy, but a woman who is under chiropractic care during pregnancy has on average 23% less labor time. So, yeah, which is a big difference.
Wow, that's motivation right there.
It is, isn't it? Yeah, and it makes perfect sense, because if things are in good alignment, they're moving the way that they should, it's going to be easier for the baby to be born. So less trauma to the mom and the baby that way. So it's a lot of fun to take care of women through that pregnancy, because it's such an exciting time of life, and to have that be that much more comfortable for them is a good thing.
What about men? What are some typical things that men come in for, other than, you know, lower back pain or injuries? Do they often come in for, because it's usually the women who are dragging the men in if it's for wellness.
Well, they say, don't they say that it's about 80% of all healthcare decisions in the United States are made by women, or something like that? So, yes, often wives will tell their husbands that they need to come in. But not always. And men come in, they do come in certainly because of different injuries or things that might happen. Yeah. But it's a lot of the same things for anyone. Having their immune system working properly, or the older men to not have the falls or be able to stay active. You know, it's really similar stuff that women come in for. So
I think too that for men, especially if they've done a lot of hard labor or have played real hard, they might have some old injuries.
Yes.
You know, some maybe shoulder injuries or something that could really benefit from some improvement.
Yeah, and especially nowadays you have kind of equal participation in sports by boys and girls, but that wasn't always true. And so you'll have you know, older men who they went through a whole sporting life where they were playing football and they were doing all this stuff, and they do have those old injuries that it does add up over time, and we're able to take care of those at that point and get them feeling better again. But that's another reason why it's important to have children's spines checked. You know, when they are going through, especially if they're in a contact sport, and the biggest two are football for boys, ice hockey for both boys and girls, and cheerleading for girls. That's a big one.
Gymnastics or something
and
like
gymnastics. And to have their spine checked after they have a trauma like that, it's been shown that they're less likely to have arthritis in those areas that may have been traumatized and had an injury 20, 30, 40 years down the road. So it's very important to address that early on.
And do you think that having some chiropractic care if someone has developed some arthritis would help with the inflammation and
Absolutely,
the pain?
absolutely. And we've had a number of people that have come in that have arthritis. We're able to adjust them, and their pain goes away, but also they get almost their full range of motion back a lot of times. It's really interesting. And, you know, to restore that for someone, they've been told, well, you just have arthritis, you're going to have to live with this, you won't be able to turn your head as well or whatever else. And then all of a sudden they can. It's certainly helpful when you're trying to back your car out of your driveway.
Well, I hope you agree with me that there isn't really one reason why we shouldn't be going for chiropractic care, not only for injuries, but for our optimum health. Dr. Eames, thank you so much for coming on our show today.
Thank you very much for having me.
Really appreciate it. It was so interesting. Dr. Eames can be reached at the Marion Family Chiropractic in Marion, Massachusetts. Their website is marionchiropractic.com. And Dr. Eames does give educational talks weekly. Could you just mention that briefly?
Every week I give an educational talk about your spine, taking care of your spine, why it's important to do it, and what you can do at home. It's 7:30 every Tuesday night. If anyone wants to call our office, the number is 508-748-6632, and they're welcome to sign up for that class. So it's 7:30 every Tuesday night.
That's great. And is there a fee for that?
No, it's free.
That's excellent.
Yeah, we're also big believers in our practice about educating the community, and that's a piece of it, and that's another reason why I thank you for letting me do this today.
Thank you. Well, I'm your host, Jackie Bell. Thank you once again for joining us on Living Healthy. I look forward to seeing you next time. You can join Dr. Jennifer Eames at the Marion Family Chiropractic every Tuesday night at 7:30 p.m. for a free lecture on various topics about health and how chiropractic care can optimize the health of your children. Just call the number on the screen and join her. Thank you.